Well, good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Yesterday, I noted that 5 of the 7 regions not scheduled to experience additional mitigations were above a 7% positivity average. Unfortunately, all 7 of those regions are now above a 7% positivity threshold. We also continue to see concerning trends in hospital admissions across the board. In particular, I want to note that Region 7, set for additional resurgence mitigations on Friday, is showing less than 23% remaining ICU and med-surg beds capacity at this time, while continuing to see increases in COVID-related hospital admissions. Regional trends are still moving in the wrong direction. In addition to mitigations being imposed to help bring down the spread of the virus, I want to remind everyone, mask up, Illinois. Keep your distance, wash your hands, get your flu shot, and think twice before taking unnecessary trips and getting together with people who don't already live with you. I also want to share with the public today 2 major updates. One about our vaccine distribution plan and one about our testing infrastructure. To be clear, there is no approved vaccine yet. But today is the day that my administration is updating healthcare providers and local health departments about Illinois' vaccine rollout framework. So I want to share that same update with the public. This plan will evolve as vaccine trials come to a conclusion and the FDA decides which to approve. First, I want to provide some background. Not long ago, the CDC asked every state to create a specific COVID-19 vaccine distribution plan in line with the agency's recommendations. Our framework in Illinois is designed to provide an equitable distribution across the state, with priority access going to our most vulnerable populations. That includes, for example, frontline healthcare workers and first responders who directly interact with and treat COVID patients, as well as staff and residents in long-term care facilities. The challenge of designing a plan now, of course, is that there's so much about the vaccines that we don't know. For example, will a successful vaccine require 1 or 2 doses? And how far apart must those doses be administered? Will the vaccines require cold storage, or can they be stored at room temperature? If vaccines are distributed in large case containers, how will those cases be split up in smaller numbers for delivery to small healthcare facilities throughout the state? So the most defining characteristic of this plan is that it's adjustable as we go forward and learn more. And you can expect transparency with that too. IDPH is coordinating with qualified providers and healthcare networks to ensure that everyone who can administer the vaccines has properly completed the state enrollment process. That's called iCare, the same registry that tracks immunization records for children. This will also help ensure all providers meet the standard vaccination storage and handling requirements. Working through iCare means that we're being as efficient as possible in our preparations for when a vaccine is ready, all while ensuring safety every step of the way. Let me be clear, Illinois will not distribute a vaccine until we have one that is proven safe and effective. We have a highly qualified team of experts from the private and public sectors teamed up to evaluate the public data and process when the vaccine data is made available over the coming weeks or months. And I'll make sure that you can hear from them when the time comes. My second major update today involves testing. Today marks our first shipments from the state of Illinois to local health departments around the state, carrying more than 170,000 Abbott BinaxNOW tests. These are the rapid antigen tests recently purchased and distributed to states en masse by the federal government. The federal government and Abbott have indicated that these shipments will continue on a weekly basis through at least the end of 2020 and will total over 3 million tests for the state of Illinois. I want to make note with some real pride that these tests are manufactured right here in our state, and Abbott has hired over 2,000 employees in their new plant in Gurnee to manufacture them. Now, this is another example of where there's no formal national plan. Every state will have a different approach in using these BinaxNOW tests. Here in Illinois, we're viewing these tests as an important additional tool in our testing toolbox. We are piloting their usage in several different settings in order to gather more data about their accuracy and sensitivity, and then adjusting our plan to achieve the maximum impact so we can battle COVID-19 the best we can. For now, the majority of the initial tests delivered to us are going to local health departments directly, ensuring resource access and flexibility on a local scale across the entire state. That means, depending on the needs of the community, the local health department can choose to distribute their tests for any of a number of localized needs, including for K-12 settings, first responders, federally qualified health centers, and homeless service organizations, as well as an array of other options. The state will also use early shipments of BinaxNOW to launch focused pilot testing programs in K-12 institutions, in long-term care facilities, as state-owned residents, in state-owned residents, such as veterans' homes, and additional priorities as they arise. The federal government is also separately sending BinaxNOW tests directly to long-term care facilities across the country, including here in Illinois, a process that started a few weeks ago. This selection and delivery is outside of the state's control. Currently, this Abbott BinaxNOW test has FDA emergency use authorization for people suspected to have COVID-19 within the first 7 days of symptom onset. In other words, we're still learning about what the test's role could be in screening efforts and other settings. Here in Illinois, we'll take what we've learned from the data about accuracy of results and scale up or adjust our programs as needed. At the end of the day, our main focus is just getting the best tests out to as many people as possible. We've had more success in that effort compared to many other states, and we'll keep working at it as long as we're fighting this pandemic. And with that, I'd like to turn it over to the director of our Department of Public Health, Dr. Ngozi Ezike. Doctor? Thank you.
Good afternoon. So as the governor mentioned, we are thinking very intentionally about the COVID-19 vaccine, and I know there will be a lot of concern about the safety of this vaccine. There is a rigorous process that is in development and part of the approval process for the vaccine. There are multiple clinical trial phases to ensure both safety and efficacy. Clinical trials have gone faster, but important safety steps have not been skipped. The entire world is focused on a safe vaccine, and all needed resources have been devoted to its development. Additionally, an independent institutional review board consisting of clinicians, scientists, and community members review the development and the study of the vaccine. Once a safe and effective vaccine is available, CDC planning assumptions indicate that 80% of the population would need to be immunized to achieve this herd immunity. That's when we think a sufficient proportion of the population would be immune to this disease, which would then make spread very unlikely. The vaccine will not be mandated, but we will work to provide all the relevant information about vaccines in general, about the importance of vaccines, about this vaccine, and talk about the testing and approval process. Right now, the Illinois mass vaccination plan for the COVID-19 vaccine will build off of our established VFC, or Vaccines for Children program, as the governor mentioned. As the governor also mentioned, various providers, initially the local health departments, but then hospitals and other providers will register with iCare and order the vaccine through the state. We will coordinate the delivery of the vaccine, which will go straight to the providers, and we will oversee to ensure equity across the state. Vaccinations, once they arrive, will take many, many months at the minimum to actually get into the arms of the people of Illinois. And so this will unfold in phases, with initially only a small amount of vaccine available, and as production ramps up, more individuals will be able to avail themselves of this countermeasure. There will not be a cost to individuals for the vaccine, although providers may charge a small fee to administer the vaccine, which will go towards insurance for those who have insurance. But no one will be turned away from getting a vaccine due to any inability to pay. While we continue to fine-tune these vaccination plans, it's important that we continue to do the things that we do have at our disposal right now. Again, of course, the masks, the washing of our hands, and the maintaining of distance. We are continuing to see increased cases, increased hospitalizations, and increased deaths, and we have to all take our role and personal responsibility in helping turn this around. Since yesterday, most regrettably, we've lost another 69 individuals for a total of 9,345 deaths. Today, we are reporting 4,342 new cases for a total of 355,217 total cases since the beginning of this pandemic. 2,338 individuals were reported to be in the hospital overnight with COVID-19, and of those, 502 patients were in the ICU and 194 patients were on ventilators. In the last 24 hours, 66,791 tests were reported for a total of almost 7 million tests since the beginning of this pandemic. While you may be tired of hearing it, the virus is not tired, so I'll continue to say it. Wear your mask, wash your hands, watch your distance, and also get your flu shot. So in other words, mask up, wash up, back up, and sleeve up for your flu shot. Thank you. And now for the comments in Spanish. Buenas tardes a todos. Sé que hay mucha preocupación por la seguridad de una vacuna por COVID-19. Existe un proceso riguroso para desarrollar y aprobar una vacuna, que debe pasar por fases de ensayo clínico para garantizar tanto la seguridad como la eficacia. Los ensayos clínicos han ido más rápido, no porque se hayan omitido pasos de seguridad importantes, sino porque el mundo entero está enfocado en una vacuna COVID-19 y todos los recursos necesarios se han dedicado a su desarrollo. Además, una junta de revisión institucional independiente compuesta por médicos, científicos y miembros de la comunidad revisa el desarrollo y estudio de la vacuna. Cuando que sea disponible una vacuna segura y efectiva, el CDC indica que el 80% de la población necesitaría inmunizarse para la inmunidad colectiva. En otras palabras, cuando una proporción suficiente de la población es inmune a una enfermedad infecciosa, la propagación del virus baja. La vacuna no será obligatorio, pero trabajaremos para traer información sobre la importancia de la vacunación, incluyendo el riguroso proceso de ensayo y el proceso de aprobación. En este momento, el plan de vacunación de Illinois para una vacuna se basará en nuestro programa estatal, Vacunas para Niños. Varios proveedores, inicialmente departamentos de salud y hospitales locales, se registrarán en iCare y solicitarán la vacuna a través del Estado. La vacunación se desarrollará en fases durante muchos meses a medida que haya más vacunas disponibles. No habrá ningún costo para las personas de Illinois por la vacuna, aunque los proveedores pueden cobrar una pequeña tarifa para administrar la vacuna. Sin embargo, una vez que una vacuna está ampliamente disponible, nadie debe dejar de recibir una vacuna por no poder pagar. Mientras continuamos afinando nuestros planes de vacunación, es importante que sigamos haciendo todas las cosas que sabemos que nos ayudarán a protegernos. Los 3 M's. Usa las máscaras, lávense las manos y mantenga su distancia. Seguimos viendo un aumento de casos, un aumento de hospitalizaciones y un aumento de muertes aquí en Illinois. Desde ayer hemos perdido 69 vidas adicionales para un total de 9,343 muertes. Hoy informamos 4,342 casos nuevos de COVID-19 en Illinois para un total de 355,217 casos confirmados. 2,338 personas en Illinois pasaron la noche en el hospital y de ellos 502 pacientes estaban en la unidad de cuidados intensivos y 194 pacientes estaban en ventiladores. En las últimas 24 horas se informaron 66,791 pruebas de laboratorio para un total de casi 7 millones de pruebas. Si bien puede estar cansado de escucharlo, el virus no está cansado, así que se usa su máscara, lávese las manos y vigile su distancia. Y no te olvides, vacúnese contra la influenza. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Dr. Ezike. Happy to take questions.
Governor, good afternoon.
Good afternoon.
I have a few questions about your vaccination plan, but before we get to that, I would like to ask Dr. Ezike. If I'm not wrong, 69 deaths is the highest total we've had since June the 17th. Does that mean we're now in that phase where the increase in the number of cases is also translating into an increase in the number of deaths?
I think we should understand that that's always the pattern. A certain number of cases will go on to be hospitalizations. A certain number of hospitalizations will go on to be deaths. And so the more cases, eventually you will get to more deaths. And so the spike in cases that we've been seeing over the last 6 weeks, yes, unfortunately it is turning into additional mortality.
Governor, with respect to your vaccination plan, you mentioned at the beginning that Illinois will not distribute a vaccine unless we determine that it is safe and effective and that there will be a team of experts to evaluate this. Is this similar to the plan that was announced by Governor Newsom in California, where they'll be establishing a panel to independently determine whether the vaccine is safe?
Well, we certainly have the resources to make sure that the vaccinations that are being offered are safe for people. Illinois, like California, like other very large states, has major hospital and medical capability and researchers and scientists. And so, yes, we are independently going to be looking at and ensuring that whatever it is that we distribute in the state will be safe.
Is there a reason why you would want to do this independently, rather than just take the word from the FDA?
Well, we've seen that the FDA, the CDC, the federal government has been completely politicized when it comes to COVID-19. Having said that, I do think that the companies that are trying to develop the vaccines are following the normal course of trials, vaccine trials, to do the right thing. The problem is that, as you've seen, President Trump has been pushing for a date certain by which he would want to deliver a vaccine, and that's just not how it works. We need to have trials to prove out whether it is safe. We have to have enough people of a broad swath of demographics in our population that are tested so that we know if there are any issues with it and so on. And so you don't set a date for a vaccine delivery. You work and work and work until you know that you've got something safe, and then you distribute it. So yes, it's obviously a direct result of the concerns that are raised by President Trump's behavior and his pronunciations.
Now, I understand that there's a lot that you can't have set in stone because we don't have a vaccine yet and we don't know which ones will get first. But can you discuss more the specific phases that will be implemented in terms of what order people will be getting the vaccine in and the populations?
I'd like to turn it over to Dr. Zike, who's been directly involved in the discussion of that. I will just say for your own edification that, this is going to be an evolving methodology that gets us to a point where we can distribute, and then we won't know, again, until we see what kind of a vaccine it is, whether you need 2 doses, how much of it we'll get, which populations we'll be able to get to fast enough, right? You want to start with certain populations, the most vulnerable, and move your way through as fast as you possibly can. That will depend a lot on the manufacturing capability of the company that's producing the vaccine or multiple vaccines. And also how long it takes to distribute those. If it requires cold storage, for example, that's more difficult and complex than something that's just room temperature. But I've now said enough about the science, and I'll turn it over to Dr. Zike.
So we know that there are going to be limited doses that will be available, when we get the first batch, and then production will continue to ramp up after that. But for that initial group, it will absolutely, the priority list would be to have the healthcare workers be first. And then as we get more, again, not knowing if that first allocation will allow all the healthcare workers, there may be further stratifications that are necessary, maybe across geography, vulnerable areas, places that have been hardest hit, et cetera. After that, we actually are, of course, looking at other critical work infrastructure, individuals who are from vulnerable populations who have borne the great brunt of this virus. We'll be looking for any healthcare workers or other allied healthcare fields that weren't covered in the first allocation. So we'll continue to work through our list. I know our providers have to go through a training that demonstrates that they understand what the priority list, and that they will be working in concert with those goals that have been specified. And so as we are getting the data of people who have been immunized, we will be looking to assure that the providers in our state are following that. If we're looking at the geographic distribution, we'll be looking at the zip codes of the individuals who have been getting vaccinated, and that can help us further direct the traffic of future vaccine to come if we see that a region that has been hardest hit by the virus, and then they have a lower percentage of people who have gotten immunized, then we would know that we would be directing future allocations to certain areas of the state that maybe have not gotten an appropriate share. So this will be a constantly evolving process as we're looking at who has been immunized, making sure that we're following the strategies. It also involves looking at the social vulnerability index. That's a CDC metric that takes into account the likelihood of a certain community to be harder hit when such a natural disaster or a pandemic or in this case, this virus hits. And so looking at those indices will help us to also direct vaccine to the right communities to make sure that the people who need it most get it first. And of course, we have to address vaccine hesitancy. So we have a lot of groundwork that we have to continue doing, because we sometimes, as is the case here in Illinois and many places, the people who may need it most might have the reason to be most hesitant. And so we're going to have to work with communities to address issues, to notify, to educate, to have their questions answered, to see what we can do to make sure, because getting the vaccine is one step, getting it into the arms of people is another. And so we need both of those for us to get to a better state with this pandemic.
I've heard estimates that initially there might be 45 million doses of vaccine provided by the federal government. Is it too early to actually put a number to it?
We don't even know which vaccine is going to be available. So I think it's very premature to have numbers. I know that a lot of these vaccines, I think we started with 14 different vaccines that were, in the running. I think it's been condensed down. Sounds like there might be 5, and then we've, heard of some that have had to suspend their trials because of some adverse effects. But there's still at least 3 that are moving forward. We don't know which one will come out first, if 2 will come out together, if there'll be 3. So a lot of unknowns, but as we know more, then we'll be able to share more and then develop more refined plans.
Okay. Governor, I have a couple of questions from my colleagues. One of them is from Fox 32, and they're asking that they're hearing from many bars and restaurants in Region 7 and 8 that simply have said that they're going to defy your order. What do you have to say to businesses that do that, and will state police be on the lookout for them?
Indeed, the state police is now alerted to be on patrol in those regions. They have the ability, as you know, to not only issue citations, but they'll start by asking people to disperse and warnings and so on. But they have the ability to issue citations, and also with the information that we get at the state level, we can take away people's liquor license, which I have been reluctant to do because it has a semi-permanent effect on a business to take away their liquor license, especially for having not followed the regulations that are set out for them. So it'll be hard for them to get that license back. But now we're going to be making sure that we enforce that.
And, you said at the beginning of this press conference that now the 7 regions that are not under mitigation are already at 7%. And I was looking at the numbers earlier. It doesn't look like they're trending well. Could we be talking next week about basically almost all of the states being under mitigation?
It's hard to say, and I don't want to prematurely, issue some information about one region or another. It is up to each of those regions to continue to enforce the mask mandate, to make sure that they're keeping within the capacity limits that we know they're supposed to. I want to just go back to your question about bars and restaurants for a moment, because I think there's a lot of confusion out there, and there are a lot of people who just don't want to believe the facts. So I brought with me, just because I thought it would be interesting for you to see, that there are 12 studies that I have right here that show that bars and restaurants are in fact a major spreading location for the virus. It's disconcerting to me that people want to just either lie about it or disbelieve the facts. We've been operating on facts and data and science from the very beginning. We're not making arbitrary decisions. In Region 8, for example, the number one identifiable place that people said when they were contact traced that they had been to either just before they got tested or after they got tested, but before they got their result, was a bar or a restaurant. And that's true across the state, that very high on the list across all the contact tracing that we're doing and we're doing quite a lot of contact tracing. We see that bars and restaurants are a place that people are visiting just before or just after they get their test. It's part of the data that we collect. And so, we're trying to be careful. Look, we're not calling for across the board, close down businesses, et cetera. That's not something we're doing. What we're trying to do is target the places where we think and know, based upon the science and based upon the contact tracing data, that it will have the biggest effect of lowering transmission. We're trying to target the mitigations to those places. So, and by the way, I also want to say, I get it that these are small businesses that have been suffering since the very beginning. This virus has been unrelenting, and it is the virus that is spreading in these locations. It's nothing. The virus is the one causing the problem. Now, what are we trying to do to mitigate the business problem for people? We've put forward a business interruption grant program, now $220 million. By the way, I want to make sure people know to go to the DCEO website to apply for those business interruption grants. We've already sent out almost $50 million in those grants to businesses all across the state. And those that are in these areas where there are now resurgence mitigations are actually brought to the front of the line, and those grant applications are evaluated first. And we try to get the money out as soon as we can to those locations.
I guess the question that surfaced yesterday, because earlier in the week when the mayor and Dr. Arwady had their own press conference talking about a second surge, they had discussed how 3 out of 4 contacts were now happening at home gatherings. And so then the question was,
Yeah.
well, if most of these new cases related to this current surge are happening at home, why are we then going after restaurants? But you're saying that it's still people.
Yes, I mean, I do want to reiterate what the mayor said, though. She's right, Dr. Arwady is right, that home gatherings, and I don't mean your family that you live with. These are gatherings where you're inviting people over. They may even be your own family, but they live somewhere else, and they're coming over to visit you. And I know, I want my family with me too, but people are lowering their guard. They're thinking that, oh, well, it's a family member. I don't need to wear my mask. But you don't know that your family member hasn't contracted COVID-19. You don't know where they were that day or the day before or 3 days before. And although they're trying to be careful, and there's no fault in it necessarily, but the virus may be living in them, on them. And so you just want to be extra careful, that's all. And it is happening, though. People are also somewhat disregarding the gathering limits. They will pack people into their home for a private party because, oh, the bar or restaurant isn't open for them to go there. And that's a real problem. And look, there's nothing that we can do about that other than to remind people that you don't want to get sick and you don't want to be one of those people that's going into the hospital or into an ICU. And you're seeing these numbers go up because people are simply disregarding. They're getting tired maybe of wearing their mask, or they just lower their guard just enough. And this is a real problem. We are surrounded by states that have positivity rates that are 2 and 3 and even 4 times the rate that ours is. And it is true that, and literally, we're landlocked, other than the lake, obviously, we're landlocked with states around us that have this problem. And we need to be extra careful about travel to and from those states. I know people work on both sides of the border and so on, but just be extra careful. Wear the mask. If there's nothing else that you hear me say today and every day, please wear the mask, keep a social distance. And the last thing, and I know there are lots of other pieces of advice that I could give about this to keep you safe, but please get a flu shot. If you get the flu and you get COVID, it is very, very dangerous, much more dangerous than just getting COVID by itself.
I can just ask you one more question that is from one of my colleagues at Telemundo, and this might be for Dr. Ezike. They want to know if you're aware of an outbreak of COVID-19 at Stroger Hospital. They've been notified of one, and they just want to know if you've heard about it, and if so, what's being done.
Yeah, so I know we have had outbreaks in medical facilities. I know I have to meet with our communicable disease team later today and get an update on the most recent outbreak. So I'm not, and Stroger Hospital is my former hospital where I worked at. I'm not familiar with that outbreak, but I'm sure I will get briefed on it very soon.
All right, thanks everyone.
Thank you.